Okay, so we'll ask all the speakers from this group here, Dr. Linhares and Magalhaes, to join us. And we're a little tight on time, but we'll still, if there's any burning questions right off the top, let's get started. So we got Gustavo and Julian with the mics. Stick your hand up so we can get a question answered.
Thank you. Good presentations. Excuse me, Alex, I have a question for you. Within your 3 categories of mortality, did you identify differences in the change in mortality? For example, did lameness change more than suddens or prolapses? And then also, if you can share, did you assign a cost or value to those changes?
Can you repeat that again?
Yeah, with your within your 3 categories, did you identify differences in where those changes occurred? So, for example, did suddens change more than the others, and then the value?
Yeah, I would tell you that we probably had the most influence over lames. Just identifying those quicker, getting an antibiotic administered more timely. I would tell you that most of the farms, after we implemented the 2-person shoring and getting more treatments administered on those sows, saw a large reduction at each farm once we did that. So the 2 main things that I would tell you did decrease were the lames and were the suddens.
Thank you. Next question. Right back here.
This is for Daniel and Edison. Any benefit on following like the PRRS strains, certain ones through all the mortality stages that you guys done? Or would there be any benefit to that?
The question is if there is any benefit of following which strain infected the farm?
Yeah, different PRRS strains.
Yeah, well, some of the benefits are just to understand where it's coming from, and if you have a history of tracking that, you know if it's coming from the own system, so opportunities for better do the biomanagement and control response within the system, versus if it's every time it's a different one, you know it's more of a biosecurity opportunity, right? And the other thing is to look at how many strains are there. If you're using whole genome, you know if it's 1, 2, 3, and of course the more the worse. And so again, if you have more than one virus circulating in the herd, that has implications on how you're gonna manage, how many doses of vaccine you're gonna use, and how aggressive you're gonna be on that attempt to lower the pressure of infection.
Maybe talk about POMP. I wonder if he's talking about variants. Are you able to track the different variants?
Go ahead.
So are you talking about tracking the different variants and looking at the outcomes? Okay, so maybe talk about POMP, we already do that, and then integrating that into Prosper eventually, tracking different variants.
Yeah, so the POMP is this program where we would provide, if you're interested, capability of monitoring the sow herd at no additional cost, because that's already included by the sponsor. So it will help the farm to continuously monitor diagnostically the farm's post-outbreak until recovery, and that monitoring is including PCR detection, so you can track positivity over time. You expect to see that positivity lowering, and if not, a whole genome sequencing is also covered by the sponsors to help ask and answer that question of which variants, how many variants, and where did it come from, with the benchmarking available across the participants and across what we also see in the lab.
Yeah, and I'll just add that taking that information further and analyzing, integrating with the downstream flows, then you can understand if there's any difference in lineage or like variants or like the number of virus. So whole genome sequencing is a really good tool, and bringing, let's say, insights from the sow farm standpoint, but you can also take that information downstream.
Got time for one more question?
For Alex or Carlos, Alex, you said on the pre-farrow, you changed how you were feeding sows pre-farrow there, and it seemed to help lower your mortality. What were you doing there? And then, I guess a follow-up for you and Carlos both of on your sows, your lame sows, are you guys seeing a specific drug or a specific combination of drugs that seems to be helping you out more than others? Yeah, so I'll answer your first question revolving around feeding sows pre-farrow. So traditionally what we did was anytime that we would load a room, we would go ahead and turn the feeders on to full blast so that sow could eat as much as we want. We actually changed it so that we would go ahead and give her 4 pounds in the morning, and then we go ahead and give her 4 pounds in the afternoon. We saw that we didn't, let me say, we didn't think that, what do I want to say? By doing that, we saw a reduction in prolapses when we did that. And as far as the antibiotic treatments or anything like that, we didn't change anything with our treatment protocol or anything like that. So we continually followed the SOP of Iowa Select Farm, didn't introduce any other treatments. So.
Okay. In our case, similar story. Actually, we used to do full feeding in sows, but now up to 48 hours after farrowing, they are restricted to the same amount, 4 pounds in the morning, 4 pounds in the afternoon, and we saw same thing, reduction in prolapses, but also reduction in issues with mammary gland, if that makes sense, better lactation. And in particular with treatment options for lameness, it depends on the reason of the lameness, if it's infectious or not, but always goes an anti-inflammatory, can be combined or not with an antibiotic based on the reason.
All right, thank you. Let's thank all the speakers of this session one more time.